Good afternoon, everybody. Just going to wait about 1 or 2 minutes as folks start coming in from the waiting room. We have a lot of interest in today's call, not a surprise, based on that information and everything going on. But again, welcome. My name is Anne Marie Hart Bookbinder. I'm the Director of Food Security Programs here at the Food Council, joined by a number of Food Council staff today. Feel free to wave if you are on camera and know who folks are. If you need any assistance during today's call, please send a chat message to Amanda Jones. Sometimes it's a little hard for me to see chats sent individually to me during the call as I'm running other things. So if you need any assistance, please reach out to Amanda and she will do what needs to be done. Give it one more minute. Again, a number of folks joining in. Please feel free to put your name and organization in the chat. Let us know who's joining us today. And Amanda will also be sharing, I'm sorry, she's already shared our agenda for today. And I did see that we are joined by some of our first speakers. So that being said, we are going to kick things off. I'm going to turn it over briefly to Heather Ruskin from the Office of Food Systems Resilience to share some updates. Thanks for joining us, Heather.
Thanks so much, Anne Marie. Good afternoon, everyone. It is terrific to see you all and be with you, and much appreciation to the Food Council team for bringing everyone together today and for the opportunity to just briefly share a few highlights from the Office of Food Systems Resilience. If you haven't had the opportunity to connect with us yet, we're one of the county government agencies, and we're focused on shaping the county's investments and policies as they intersect with the food system. And there's a lot going on in our community right now related to food access challenges as well as opportunities. And so just wanted to make sure that everyone knew that we are closely following all of the impacts of the government shutdown, as well as the larger impacts of federal budget cuts and policy changes related to food access. And so I'll put a bunch of links in the chat box after, but we have regularly been updating the news blog on our page with information about what the landscape is. We posted something just a couple days ago about what resources are available during the shutdown. Things are changing very quickly, so please stay tuned. But in general, October benefits for SNAP have been dispersed already, and there is additional funding that was made available by the federal government for WIC for October. The federal government has said there are not sufficient funds to continue resources through the full month of November. So I know there are conversations happening at the state level as well as locally for what the options are that are on the table and what the possibilities exist for what benefits will look like for our neighbors, but just wanted to make sure you all knew that we're closely following it. We also had the chance to update the full county council last week on Tuesday, and I'll put a link to that recording in the chat box as well, where we really break down all of the impacts of HR 1 and the shutdown on our local food system. And please continue to keep our office updated with what you are seeing on the ground at your own distributions and services site. In the next couple of days, we will be releasing a pulse survey, basically a very short, quick response survey for all of our food assistance provider partners. And so please take a moment to make sure your organization responds. That will give us a chance to hear in real time what you're seeing, not just in terms of overall numbers, but specific populations that you may be seeing coming for the first time, others that traditionally are coming and are not showing up or asking for different services than they've traditionally accessed. So please know that whenever we ask for input, we are listening and we are taking that information and directly incorporating it into the strategies that the county government is developing to respond to the need with the resources that we have. I think you've also probably seen in the news that there are budget limitations that are present and forthcoming at both the county and the state levels. And so that means that we will be strategic with every dollar that we have, but it also means that there are not unlimited resources like there may have been in past emergencies. And so collaboration and efficiencies across our partner network is more important than ever. And so we just appreciate everything that you do to serve our community partners. And then the last update that I just wanted to share is I know many of you have submitted applications for the Community Food Assistance Grant Program. We are doing everything that is within our control to move that forward as fast as possible. I'm hoping that the reviewers' scores and feedback will be wrapping up today, and so that we'll be moving things forward as quickly as we can. But just want to make sure you all know that that is very much on our radar, and we're doing what we can to make government move quickly. But thank you all so much for your partnership and for everything you do. And please don't hesitate to reach out to me or any member of our team, except for Catherine, who is on Fulbright in Italy. Really excited for her, but also just leaving our team a little spread more thin than usual. So if you send her an email, you won't get a response. But any one of the rest of us are here and eager to hear from you. So thanks again, Anne Marie, and happy to answer questions in the chat box or offline.
Great, thanks so much. I don't see any questions that haven't been handled in the chat, but again, feel free to include them there. I will also share a little bit on OFSR's behalf. Just thank you to those of you that participated in their food assistance provider census. If you are a food assistance provider who is not currently receiving funding through the Office of Food Systems Resilience, we would still very much love to hear from you. And I know that many of you have participated, and we thank you for that. I will share the link again momentarily in the chat in case you haven't had a chance to do that. The link is still open. I checked this morning, so you can still submit, and they will gladly take your submission. Also noting that OFSR will be presenting to the County Council's HHS committee work session on Thursday, October 30th at 1:30 p.m. Again, I will share a link where you can find more information as that becomes available. Just a reminder that these meetings are open to the public. You can watch them streaming. So if you want to know what county council members are asking about food insecurity and other food related issues, definitely tune in or join in for that. And also another reminder, since this is usually the time for our food system advocacy call, I do want to remind you, like we covered at our last meeting, that the county executive is hosting FY27 operating budget forums. A number have already taken place, but there are still more happening throughout the rest of the month and into November. And again, we will provide a link of where you can find information about those and how you can participate either streaming in person or submitting questions in case you are not able to attend. All right. And with that being said, I do see our main speaker here today has joined us, Sabrina from the Capital Area Food Bank, and a number of other Capital Area Food Bank colleagues joining her today. But Sabrina, I will let you take it over here with the presentation of the 2025 Hunger Report, and please feel free to highlight any other staff members that are joining you.
Okay, great. Thank you. It's a pleasure to be here with you all again. I was excited to have this opportunity because I have done it, I think, for 2 years now, and this is the third year that we've come to this group to do kind of a custom presentation of the Hunger Report. So I'll share a little bit about the findings in just a moment. But for those who don't know me, my name is Sabrina. I work at the Capital Area Food Bank as the Senior Director of Strategic Initiatives. And I know I saw Gabby on the call. I'm not sure if Roberto or Joe are here too, but just those are, I see Roberto's face right there. So those are some of my other colleagues who are with me today. So let me jump in. For those of you who are new to the Hunger Report, I'll just start with an overview of what it is and why we produce it. The food bank has been producing a Hunger Report for 6 years now. This is our sixth one. We started in 2020. And really, we undertook this initiative when we wanted a regional DMV-wide snapshot of food insecurity and couldn't find one. So we decided we would produce one. And we offer the report to the community, obviously to our staff and ourselves, but really to stakeholders like yourselves. We really see you as one of the prime audiences of this research, and we hope that you find it useful. And we're open to collaborating on the design of the survey that underpins this report, so that you find it useful, and obviously on how we slice and dice the data for your information. So you are kind of our key stakeholders in a way of this report. But in terms of methodology, it's a general population survey. Over the years, the average N is about 4,000 households that are randomly sampled from across the DMV. The sample size is so large because we capture representative samples of every county. So all the data that I'm going to share, when it says Montgomery County on the slide, you can trust that this is a representative sample of Montgomery County, weighted for diverse characteristics like race, income level, educational attainment, etc. So we do it at this level on purpose for those of us who have kind of specific geographic service areas. And I always want to highlight before jumping in that it's really important to us to keep our clients at the center of this initiative. We call our food insecure neighbors our clients, and we engage with them at the very upstream moment of designing the survey that we use. When we get the data back and we start to kind of sketch an outline of the report, we go to our clients and we have a focus group where we ask them, like, does this resonate with your lived experience? Does this feel accurate and true as a representation of what's going on? And for those of you who have seen the Hunger Report, maybe if I can manage to multitask, I'll put a link to the report in the chat. But for those of you who've seen it, you've seen, like, we have their videos where they're telling their own stories all throughout the report. So that's really important to us, and we've committed to doing that over the years, is keeping our clients at the center of this project. Okay, so I'll jump into the findings, and I'll try to distinguish when I'm talking about the DMV as a whole versus Montgomery County specifically. But starting at the most zoomed out level, we found that food insecurity remains elevated across the DMV. This year, 36% of households screened as food insecure. We use the USDA's standard screener, which I'm sure all of you know has been employed until very recently. The USDA just announced they will not be doing this survey anymore starting this winter. So we use the same exact questionnaire, and the way that they define food insecurity includes these two green slices of the pie, which are very low food security and low food security combined make up this 36% that I'm referring to here. And this is essentially unchanged from last year. The margin of error is 2 points, and it's a 1 point difference. So we consider this flat from last year, but certainly elevated from 2023, when 32% of the region screened as food insecure. And these, persistent rates, the trend is consistent across geography, race, income. It's not highly variable. So we're confident that it's basically an entrenched issue from last year to this year. It's not really changing that much. I mentioned, the tiers of food insecurity, the 4 levels of severity. For those of you who aren't familiar with the screener, depending on how many times you say you've experienced a certain kind of expression or dimension of food insecurity, you get sorted into one of these 4 levels, with the blue teal being like a 0 or a 1 number of times that you said that, yes, this happened to me. And our big, one of our biggest findings this year is that the very low food secure category is in a consistent growth pattern. We've seen over the last 3 years a 2 point increase, which equates to 75,000 people, additional people who are in this category of very low food security, which is really going beyond you know, sometimes not being able to afford the kinds of food that you prefer. This is disrupted eating and reduced food intake. And there are people who are saying yes to questions such as, I did not eat for an entire day because of money or something like this. Or even like reducing children's food intake because of money. So it's pretty severe. And we're very concerned to see that as a region, we're in a consistent growth pattern here. And now I want to start diving down into the county level. We can see Montgomery County is kind of sitting in the middle of the pack for the whole DMV at 35% of the region. Your neighbors in Prince George's County, you can see at the top of the list, are at a full 1 in 2 households, which is extreme. But even in Arlington, which is the least food insecure, it's still more than 1 in 5 households. So there is a range, but it is all concerning, even at the low end at 22%. Then I also just wanted to show you the breakdown with the severity levels. So again, the bottom 2 stacks combined equal the food insecure population. And so for Montgomery County, there's your percentage here. I think there might be just like a tiny bit of rounding for the 1 point difference, but it is a slight majority of all of the food insecure people in Montgomery County who are very low. So we could say about half of them are in the most severe category. And then looking at your trends over time, you've gone from 30 to 27 to 34 to 34. Now, the margin of error is a little higher at the county level at 6 points. So I think what I would say with confidence is that this jump from 23 up to 24, 25 is significant. But this one, since it's only a 3-point difference, it could be within the margin of error for the study. So we would say that food insecurity has been elevated in Montgomery County since 2023. And we also, you know, for those of you who are familiar with the report, we don't only ask questions about food insecurity, we ask dozens and dozens more questions because we know food insecurity is not an isolated experience. It's really embedded in this broader context of financial insecurity. And so one of the questions that we ask about is, are your finances getting better or worse relative to 12 months ago? And this is a slightly interesting trend compared to the rest of the region. On average, we were kind of at like 35, 35, and then jumped up to 40 who are saying that their finances are getting worse. In Montgomery County, interestingly, it's kind of like a V shape where it seems like in 2023 and 2025, it was a little worse for people, that more of the population was saying that their finances are getting worse. But regardless, the big takeaway for me is that only 14% are saying that their finances are getting better. And you know, it's like you know, the rest are either staying stagnant or getting worse. And that's it's very concerning overall that so many residents are having this economic experience. And if we were to zoom way, way out, this is back to DMV data, but this data just doesn't exist at the county level. And we were to look at these economic indicators to understand how it's possible that that many people are saying their finances are getting worse. We want to look past macroeconomic indicators like, oh, like national unemployment is very low right now, or oh, like national GDP is high. And just ask like, well, what about the cost of stuff and how much money people are making? So if we look at the consumer price index, the CPI, cumulatively over the last 5 years, we see a 21% increase in the cost of stuff from May 2020 to May 2025. At the same time, wages have only grown 6% in the region. And so for everybody who was sitting just at like a break even, living paycheck to paycheck, they're now underwater. And that, I think that really helps explain how it's possible that so many people are saying that their finances are getting worse. And if you were maybe living a little with a tiny bit of cushion, maybe now that cushion is gone. And so that, you know, just helping explain, especially to, I know in this, you know, virtual room, I don't think that there are a lot of skeptics of these numbers, but sometimes you have to show people economic data like this to explain how it's possible that a third of a population could be food insecure. Now, obviously, we know Heather mentioned it. We can't avoid talking about what's going on with the employment landscape in the DMV and the losses of federal jobs specifically. So naturally, we were tuned to this when we did the report. We knew that we needed to look at it closely, and so we isolated the households who had one or more federal government workers or contractors and looked at their prevalence rates for food insecurity as a standalone group and found that 41% were experiencing food insecurity back in May, because that's when we did the survey in like May, June. So, regionally, there were about 29,000 people at the time who had separated from the government, and we found that 41% were already food insecure. So that's about 5 months ago. And it's very possible if more of the people who were sitting in like this blue or light green category have not found employment since then, that the picture has changed for them. So this is a point in time about 5 months ago. And I keep going back to this kind of distinction between the very low and the low. And for this group, about 2/3 of them were already all the way at the bottom. And, again, trying to step back and look at economic data to understand how this is possible. The average incomes of folks who screened in this category were household incomes of about $100,000. And at that household income level, the other public data suggests that they may have had 1 to 2 months worth of savings in the bank. And that is a very short runway if you can't find reemployment after that. So that, how is it possible that so many people slipped so low so fast? Well, like when you think about it, it's not that hard to imagine if you only have 1 to 2 months savings and it's already been several months and it kind of just keeps dragging on. So that's obviously a major factor for what's going on in the region. When you look at other populations, just to understand those statistics and context, the middle bar is households that had at least one federal government worker contractor who did not lose employment. And then all the way, the third bar is the whole general population. So there are more, separated feds who are food insecure than the general population rate. So we're definitely watching this population closely. Then looking over to how are people coping, what are the kinds of behaviors and decisions that people are facing as they're in these situations. This data on the left is Montgomery County specific. These are residents' financial behaviors in response to all of this, kind of economic stress that we've been talking about. So 64% said that they have been using savings to pay for housing bills or other payments. That is really troubling. 43% say they're making minimum payments on credit card bills. 39% say that they've stopped saving for retirement, college, or other future expenses. So they're really borrowing against their futures to keep food on the table today. And even 17% are literally taking out of retirement early to help keep the lights on now. And if we were to double click on this credit cards piece and look at this map, in Montgomery County, there's been a 46% increase. This isn't the absolute delinquency rate. There's been a 46% increase in credit card delinquencies in just 2 years. So we know that people are floating their budgets on credit. And in the report, we also talk about people using buy now, pay later. If you're familiar with that, like Klarna, or you can use Klarna on Instacart and buy your groceries on buy now, pay later. So people are doing this. 20%-ish of users of buy now, pay later users are using buy now, pay later to buy groceries. So it's definitely, we see kind of like a growing financial storm cloud with this population. And really it's gonna, kind of precipitate into something much worse very soon is what we're worried about. I mentioned decisions and trade-offs. These statistics on the right are food insecure residents in Montgomery County who say that they have faced a choice between food and X in the last 12 months. So these folks are facing really impossible lose-lose trade-offs between paying for food and paying for my credit card bill. We just talked about that. or food and utilities, or food and rent, food and transportation. And for many of these, like I said, there's no winning. Like I lose either way, whichever one I cut, because either I'm not feeding my body or my family's bodies, or I'm going to get the lights cut off, or I'm risking getting evicted, or I'm not going to pay my car payment. Maybe my car is going to get repossessed, or I'm 50%. I'm going to I'm not going to take that medicine. Maybe I'll just take it every other day. And so these are really difficult trade-offs that are going to have long-term impacts over time. Another thing that we asked about was whether folks' food insecurity is affecting their ability to perform at work. One of the most powerful videos that in my opinion, in the report is this woman named Angela. I got to talk to her before she filmed her video, and she's living with lupus and she talked in the video about how when she has enough food to manage her autoimmune disease, she's like, I'm killing it at work. I'm like finishing all my assignments. Like I'm doing great. And when I don't have the right food for my body, I have brain fog. She shared with me personally, she was like, I almost got fired once because my boss thought that I was lazy, but it's really that I just couldn't manage my disease because I didn't have the right food to put in my body. And so anyway, we brought a lot of data to this to show food insecure people are much more likely to be experiencing workplace impact if they have a chronic disease. And this really makes it a workforce issue. Like we want people to be able to be productive members of the workforce, and their food security is clearly part of that because they're reporting being less productive at work at higher rates than food secure people with chronic diseases. Okay, and then I just have like a few more big giant things in the background that are obviously affecting all of this. And then we'll talk a little bit about our recommendations. Obviously, everyone on this call knows that this summer historic cuts were passed to these two programs, SNAP and Medicaid, among others. The Urban Institute did an analysis for us and found approximately 50,000 families are going to lose about $187 a month of SNAP benefits. And at the same time, 116,000 people in the DMV are going to lose Medicaid due to new work requirements alone. And in the DMV, there are over 100,000 people who rely on both of these programs. And so it really is kind of like a perfect storm of a lot of different factors all coming together at the same time. A little bit of a pivot here, and I do have one bright spot for you for Montgomery County. Okay, so some of you who were in this presentation last year saw we were talking about the unreached population, meaning people who are food insecure but not accessing charitable food. In your county, 56% of food insecure people access charitable food. Relative to the rest of the region, that's kind of high. And it's over half, but it also means that 44% are food insecure and not connected to any of your organizations. But this is my tiny little bright spot for you. In your county only, like in the whole DMV, no one has this trend, but we have been seeing less unreached people in your county compared to the whole rest of the region. I mean, in one county it's going up, but everywhere else it seems to have kind of like this tent shape. And I think that we can assume, maybe even conclude, that the level of investment that you all are doing in your county alone is driving this number down, of people who are food insecure but disconnected from any form of support to kind of close their food budget gap. So you should be really proud of that. And then I just want to bring this back because everyone, wants to, if you see there's that many people who are unreached, you want to know why. So these are findings from last year, but we asked for those who were food insecure but not engaging with charitable food, why? And just to recap, we saw the top 7 reasons that people said, like, that's a major reason why I don't, relate to awareness, convenience, and stigma. Under awareness, it's simply like, am I even allowed to go? I don't know. Or I don't know where I would go or when I would go. For convenience, some of you who are our partners may have engaged with our teams around hours of operation. We found last year that our food insecure neighbors actually would many of them, not all of them, would prefer nights and weekends, and virtually none of our distributions happen at those times. So that's one thing that we could do, easy win to address some of this kind of missed alignment with schedules. And then stigma, I should flag, this was a year ago, before a lot of the kind of environment and culture changed, particularly for our immigrant neighbors who we know are feeling very uncomfortable coming out to food distributions right now. Not universally, but we've heard that that's an issue across the board. But I don't want to share my information. I don't want other people to know I need help. I don't feel comfortable at food distributions. Even in 2024, people were reporting those as issues. So I see a lot of these things as addressable. The food bank has been working on and kind of strategizing around these as well. So I hope that this is actionable, useful information. In terms of actions, I'll say, the food bank, the hunger report rather, is written to a really wide audience. Like I said, I want the data really for you all. And I think that in terms of recommendations, a lot of those are geared towards the public sector and the private sector. So not all directly at you, but we looked up a few recommendations in the report. I might just skim over these briefly. And if we want to double click, I have more slides on them. I also have an appendix of a bunch of stats that I would love to just share with you all on Montgomery County food insecure people. Just use them in your advocacy or your fundraising if it helps you. But and I'll share those with you, Anne-Marie, and you can share the slides. But our recommendations were, number one, to protect families from SNAP cuts. We know what has been done at the federal level, but now the states have some choices to make about how they implement and respond to a lot of the decisions and the new cost sharing and et cetera that has become the new reality. And there are some ways that they can do this. One thing that we're really focused on is preserving school meals where possible. We don't want to see children losing those. And the second recommendation is around removing barriers to upskilling for food insecure people. We know from our data that food insecure people are very interested in growing their skills to increase their income potential, but they face significant barriers that have to do with cost, but also like the opportunity cost of foregoing income to go get educated. And the food bank is really committed to removing some of those opportunity costs and direct costs of education so that people can upskill and transition into higher paying living wage jobs. And then finally, we have a lot of work that we've been doing in partnership with healthcare providers around integrating food into healthcare in clinical settings through things like food pharmacies and home delivered groceries for children with diabetes, for example. And so we think that that's a really important part, given the data that I shared earlier, a really important part of a holistic approach to serving people's needs. So I know that was super fast. I wasn't watching the chat. I don't know if those were more introductions or any questions. Anne-Marie, I hope you can steer me for how we want to talk about this, but we can open the floor, have a discussion. Obviously, anyone on my team, I would love for you to jump in during discussion or add anything that I missed.
Absolutely. I don't see any questions yet in the chat, but please do feel free. We have plenty of time to discuss this information. If you have a question, feel free to raise your hand or put it in the chat. And we will get to that. I did just want to say, first of all, Sabrina, thank you so much. As always, these presentations are incredible. I really appreciate you comparing numbers to last year for Montgomery County and helping us see some of those differences over time. It is wonderful to see the percentage point, a few percentage points drop in lack of awareness of where to obtain food assistance in the county. And really a thank you to all of our providers for everything that you're doing to get that word out in the community. I do see one question now in the chat on key finding number 8. Oh, sorry, my thing just jumped. Do we have any sense of how many of these households are in Montgomery County?
I would say that the sample size isn't large enough for me to say that with confidence. However, we know, given some of the government agencies that are located in Montgomery County, it is a high proportion. I would also point you to the Metro Washington Council of Governments has a whole web page. I think I can probably grab the link really quick. That has tons of useful data on the concentration of federal workers by county and their incomes and a whole bunch of different stuff that you could use. Montgomery County does have a lot. So I think that's a better source of directional information than our survey, because it's a general population survey. So you got to think like maybe only 500 people fell into this category, and a lot of the rest of them don't work for the federal government. So for me to splice that down by county, I would feel a little bit nervous to draw a conclusion. So let me see if I can find that COG link, and I'll share that with you. Anne-Marie, why don't you steer me to which question you'd like me to answer?
Yes. I kind of did a little summary in my head, but we do have a question in the chat. If you could just share, and I know that this has come up in other times, the discrepancy in the numbers that you see between what we might see in, say, a Feeding America assessment of hunger in this area, or USDA numbers. Can you share a little bit more about why those numbers are noticeably different?
Yeah, such a good question. The first year that we did this, meaning the general population survey year one, we were stunned because we've been using that data for a really long time too. And we spent a long time with our research partners, NORC, talking about what the differences could be. And it really, first we had to start with like what they can't be. It can't be because the questionnaire is different. It can't be because the weighting and sampling is different. However, on weighting and sampling, we're capturing way more people at a county level than they are. They sample at the national level and the state level. So what you have from Feeding America is state level data modeled down. Models are models. So we have confidence in their state level findings, but everything is different. And our this is like reason number 3, the cost of living in this area is so high. So I think that in some ways models start to break down a little bit when you are trying to assume that because this is this here and this is that there, and that's what people make there, that many people are probably food insecure in Montgomery County. So they're just different methodologies. And maybe one other thing I would say on cost of living, the Feeding America data is actually census data. It's from the American Community Survey, and then they take it, they do that modeling. And the ACS uses a screener. It's like a pre-screener where they just ask 2 questions about food. And if you don't say yes to one of those 2 questions, and you make 185% of the poverty line, which is not that much money, 185% in this region, depending on your household size, like $45,000 is not that much money. They just go, you're probably food secure. No more questions. We're not going to ask you any more questions. And we replicated that, and we would have miscounted 1/8 of the food insecure population as food secure if we just didn't ask any more questions and said, well, you make so much money and you didn't say yes to these 2 things, so you're probably fine. So there are a few differences, but because we've been doing this for so long and we keep finding the same thing, we also have some friends at the Boston Food Bank who are also doing their own thing and also having numbers in the 30s. In terms of prevalence rates, we feel pretty confident that these findings are accurate.
Thanks for that really thorough explanation. Stephen is asking, and I guess this is, I know there are other team members. I see Roberto here, or Gabby who may be able to say something. But given the persistent dire need for food assistance and concerning prospects looking forward, how successful are we in food recovery? How much more is possible?
I would have to kick that to someone.
Yeah.
I can take that one. So yes, with food recovery, there is a lot that goes done for recovery currently, and it's done through our partner network. And there is, there's still room to do more. And I think that's something that we've been having conversation with different institutions about what more can be done, or how can we become more efficient with the food waste, I will say. And so it doesn't go to waste. So it's something that we're currently working, but a lot of the food that we distribute to comes from food rescue, and that's under our partner direct programs. So some of our partner networks are familiar with that. And basically that's a program where we partner, one of our partners, we create a relationship with one of the grocery stores so they can directly go and pick up that food from them, and they use it for their distribution. So a lot is being done. But as always, as any program, every year we're looking into how to improve, what else can we do, and what other partnership we can create to kind of incorporate all those sources of food that might not be included currently in our program. Currently, it's just major grocery stores that we partner with, and we do recovery for them. And I like you put the specific question about how how successful we are on that. I think we're doing a great job, but there's always something more to do. And I think that's kind of the big question we have even for our network, right? How successful we are in addressing hunger in our communities, right? It's just the need is just keep increasing, keep shifting. So it kind of seems like a moving target, but it's always trying to keep the clients in mind, what the current need, and trying to address the best as we can with the limited resources that we have.
Thank you, Roberto, for jumping in there. I just want to, I don't see new questions exactly on this topic, but Sabrina, you had mentioned some other slides that you had to share. Maybe let's look at those and see if it, kind of encourages any further discussion. And I think some of us too also kind of, it's a lot to take in at one time and maybe don't even exactly know what the question is to ask. And I know your slides are always so helpful with that. So thank you.
That's fair. It's a ton of data. And I also have a lot of practice presenting this, so I'd probably go through it too fast now. So apologies if it was too fast. These pages, I'll take a quick pit stop. I think what you might be most interested in is what I've put in the appendix. This is some data showing food insecure people have expressed interest in taking on these living wage in-demand jobs in the region if given the training. And we asked this question specifically for our private sector friends to say, you have untapped labor pools in this population. If you would invest in them and their training, they could be the people that you need in these jobs. So we really don't want to leave these people in low wage, minimum wage jobs when they could be doing, they've expressed interest, they could be doing these jobs. But the barriers, why are you not engaging in skill development? I can't afford it. I don't have time. I can't take time off of work. I don't know where to go. I'd rather pick up gig jobs, things like this. So that's that. This is kind of a nice infographic that we put in the hunger report around all of the different stakeholders engaging in a system level approach to food as medicine, which would lead to better health outcomes, lower cost of healthcare, and a more productive workforce. But let me show you these appendices. Again, this is specifically data on food insecure residents of Montgomery County. And I hope you use this to characterize them to your funders or to the people that you're advocating with. I provided data on their racial composition, US versus foreign born. Off the top of my head, this is one of the highest rates in the whole region of foreign born. The spectrum of the income distribution, their age, their educational attainment. Look at this, 25 plus, so 48% have more than a high school diploma. That to me says that these are people who could have different jobs if we helped connect. And back to the foreign born point, so many people have skills from employment in other countries and come here and are underemployed. So there are a lot of interesting statistics here that you could dive into. Employment rates, 58% working, 7% working more than one job. But you have 5% retired, 6% disabled, 18% not working, which would be like, I'm looking for work, and then 13% other. Also, I have some health statistics for you, the self-reported, but chronic disease rates, how frequently they've been going to the doctor, are they insured or not insured? Are they receiving government benefits? One thing I'll note here is there are some things that are conditional on your household structure, like for example, 6% for your reduced high, but that includes households that don't even have kids. So those rates would look a little bit different if we trimmed all of the populations by eligibility. But there's of all food insecure people, what they're receiving. This is a little more nuanced data on SNAP cuts in Prince George's and Montgomery counties combined. So I don't have the data disaggregated, but for our 2 Maryland counties in the food bank service area, this is your average losses of $164, $101 for families with children, $131 for working families who may not have children. And then, interesting, we talked about, populations who may not feel comfortable at food distributions presently. We asked a question about their comfort sharing personal information at food distributions. And these numbers represent the uncomfortable. I would either be not very comfortable or not comfortable at all sharing a picture ID, my home address, my income level, my name, my immigration status, or my zip code. So I know all of you fall on different places of the map on, how much you ask for at your food distributions, if you do direct distributions. But for what it's worth, this is what people are saying right now in your county about how comfortable they feel providing this information. Obviously we're super data driven as an organization. We don't want to advocate for ceasing collection of all data, but it's also good to be respectful of what people's comfort levels are in the current environment. So for what it's worth, I provided this for you too. And that was my last appendix slide. I don't know if that stimulated any other additional questions, but for what it's worth.
I did see one from Christina noticing that teaching wasn't in the list of careers that others may be exploring, and that is something that MCPS is actively seeking in Montgomery County. So
those data, the jobs were pulled from regional analysis of jobs that fit a bunch of criteria. They have to pay a living wage. They have to have a growth projection over a certain threshold, and they have to have a number of openings over a certain threshold. So I'm not sure which of those disqualified teaching. And also I'm not sure that it would be it could be different in each county, and that was a regional snapshot. So I mean, teachers are so important. I think it's one of the most important jobs. I don't know. We don't know if food insecure people would go into teaching from the question, but it's not to say that that's not an incredibly important and in-demand profession.
Yeah.
I see Carol's question, the exclusion rate, it was 185%. It's just a formula that they came up with. If you make over 185%, and you don't answer yes to these 2 questions, we discount. We don't force you through the whole food security screener. And it's not geographically specific. That's just their methodology. That's just how they do that. And then a question got bumped. Is there a coalition around food insecurity that's formed in preparation?
Yeah, we'll circle back to that in our in our following conversation. So I put a mental pause on that one. But I am seeing Dana asking if you'll be sharing data from the recent food assistance provider survey that CAFB partners that may provide another snapshot, for things that they could use in their own advocacy.
I'm not familiar with the food assistance provider survey. Is that something that you all administer with your providers?
No, that is the CAFB, Gabby.
I think we can answer this one. Hi, Dana. Hi, everyone. Yes, this is probably the biannual survey. Okay. So so we will be sharing information, and we generally do this in our partner engagement hours. That happened the 4th Friday of every month. So those are going to be happening this Friday as well. So but for the BAPS, we'll make sure to notify that through our newsletter. So just keep an eye on that. But yes, we actually had a presentation on it past month on the spring one, and we will be having on the fall regarding the data collected on the fall as well.
I do want to note that our partner engagement hours are going to be a very similar topic. The same team will be presenting. So feel free to come again if you want a refresher.
Right. So another opportunity, and this will come, we'll show data, PG data as well.
Thank you. I just one other follow-up from what Sabrina had mentioned that we had discussed before. Sabrina mentioned the hours that food assistance providers are in operation and whether, those aligned with what clients were looking for. And I know, again, evenings and weekends being a challenging time for residents to find food assistance sites. That is something we discussed a number of months ago as well in one of our food security community calls. We just kind of did a random sampling of the county of OFSR's food distribution calendar and kind of, compared those numbers approximately. We had a very similar situation here with what we were seeing with providers that, some of which may have been, the same sample of CAFB partners, and some of which were not. So, we're always happy to kind of compare our data to what you're seeing with CAFB partners, and again, have conversations around those in that space. How can we better, what are residents looking for and how can they be better served? So appreciate you raising those findings from the survey as well. That is all I see for questions. Again, as always, feel free, if you think of something after, feel free to put it in the chat. I'm happy to get it to Sabrina for her to address in follow-up. She's always been incredibly, generous with her time. So again, just Sabrina, thank you so much for joining us today. And we will share, she'll get me the slides and we will share those out, as we always do in our follow-up call resources. So thanks again.
Thank you.
Thanks. I'm going to turn things over now to Allison of our staff for an update. I know Heather covered some things around the federal shutdown, but Allison will tell you what we do and don't know at this point, just so everyone is on the same page.
Thanks, Anne Marie. Hi, for those of you who don't know me, my name is Allison Schnitzer. I'm one of the co-executive directors here at the Food Council. I'm going to cover two things. One, what we know about November SNAP benefits, which, spoiler alert, is not very much. And then two, the SNAP changes that are going to be happening on November 1st that were part of the bill that was passed in July. So I'm going to kind of go through those a little bit. So this morning we had our monthly meeting with Maryland DHS. This is with all of the community-based organizations that assist with SNAP applications. They reiterated that October benefits, they've gone out across all programs. There's been no interruption in that in terms of the schedule or their amount. But November benefits are still completely uncertain. And that's because no money has been appropriated for them because of the shutdown. I think everyone has seen in the news, and you may be aware that the USDA sent out a letter to states requesting that they hold their November SNAP benefits. Maryland DHS did confirm that they did receive this same letter from USDA, and they've been working to try to figure out what they can do, what their options are. They're trying to get answers from the federal government. They're also working with other states to try to find some creative solutions. They stress that this situation is changing minute to minute, and they will communicate as soon as they know anything. And as soon as we hear anything, we will communicate it out to everybody. I know that it's a very stressful time, as nobody knows what is going to be happening, if benefits are going to be going out. People are relying on these benefits. Of course, we're aware of that, as is everyone in our local government and our state government and our federally elected officials. So, like I said, it's a ever-changing situation, and as soon as we know anything, we'll get the information out. I did want to share, with the bill that passed in July, there were several SNAP policy changes that are now going to take effect November 1st. We host a SNAP work group here at the Food Council. Our next scheduled meeting was supposed to be next Tuesday, but DHS has called a meeting in person to go over these changes. So I let everybody on the SNAP work group know about that meeting. If you are interested in attending that meeting and didn't get that email from me earlier today, just send me an email. Maybe Amanda can put my email in the chat, and I'll share the information about that meeting with you. That's really for community-based organizations that assist residents with SNAP. So I just want to go through the changes that we know are happening as of November 1st. So the big changes are around the definition of an ABOD. So that's an able-bodied adult without dependents. Essentially, this group of ABODs has expanded, and ABODs have to meet work requirements in order to maintain their SNAP benefits. They get 3 months of free SNAP benefits, and then they are no longer entitled to SNAP benefits unless they meet a 20-hour-a-week work requirement, either working part of a workforce training program or volunteering. So this kind of lays out the policy changes here. It used to be that you would have an exemption for homelessness. Veterans used to be exempt from work requirements, and children aging out of foster care were exempt. These groups of people are no longer exempt from work requirements. Another big change is that it used to be if you had a child in your house under 18, you were exempt from a work requirement. Now the child has to be 13 or younger. So if you have a 14-year-old child as the oldest child in your house and you have no other younger children, you are now required to meet work requirements. Another big one is it used to go up to age 55 and now goes up to age 65. So we are going to have a large portion of our senior population that will now be required to meet work requirements. We have been working with different organizations who help these populations on trying to understand these work requirements to try to connect people with either disability exemptions, make sure everybody has that form to get an exemption for a disability, and also to find creative ways to meet work requirements and connect people with workforce training programs, SNAP ENT, and volunteer opportunities. So we've been working with Maryland Hunger Solutions on that, so we will share more about that as that develops. Another policy change is that there used to be a standard utility allowance on the SNAP application that you would be able to get if you received the Maryland Energy Assistance Program. It was automatic. Now you can only get that if you are elderly or disabled. So that is going to be changing the SNAP calculation for a lot of households that don't have an elderly or disabled member in the household. So that's another change that will be happening on November 1st. And then a big change that's going to impact a lot of people here in Montgomery County as well is that whole categories of our immigrant population that used to be eligible for SNAP are no longer going to be eligible for SNAP. Specifically, refugees and asylees with status, they used to be eligible for SNAP, they are no longer. It is a very limited, I'm not going to kind of go through the whole old policy, but you can see the groups that were allowed, and now it's only lawful permanent residents, and there is still that 5-year bar for them, the Cuban and Haitian entrants, and then you can read the other category that's allowed. So there's a big limitation on the immigrant population that's eligible for SNAP. We don't have precise numbers on how many people this is going to impact here in Montgomery County, but we're assuming that it's going to be a pretty significant impact. I do have action transmittals to share from DHS on the ABOT expansion and the standard utility allowance. They are still working on the action transmittal for the changes in eligibility around the immigrant population. So when I have that, when we get that finally, we'll share that out as well, and I'll make sure that these slides plus the action transmittals get over to Anne-Marie to get out with the follow-up for the meeting. And that's all I have. And if anyone has any questions that I can actually answer, I'd be happy to try.
I think Allison Diana had just asked if it was possible to get a copy of the letter that you referenced at the start of your presentation.
I mean, I haven't seen the letter. I've seen, it's been referenced by the state, and it's been referenced in different articles and stuff. I haven't seen it. Somebody probably has it, but I don't.
Cycling back to the earlier question about food security initiative as part of the state legislative session. Unfortunately, I don't think, I think I saw someone on the call earlier from Maryland Hunger Solutions. I think they had to jump off, or I would ask them to speak here. They always lead a lot in that space. I will just make mention that, you know, the Food Council and OFSR are very engaged in the Maryland State Food Systems Resiliency Council. And they did release a report of recommendations. Diana Taylor, who's also involved in that work, is on the call. And you know, unfortunately, many of those recommendations were kind of considered and reviewed and put forth prior to different policy changes being enacted and taking effect at the federal level. So we'll just have to see, you know, what is, you know, which of those are feasible for the state assembly to consider this year. But you know, as we've spoken in the past about, you know, different work just to promote basic needs and food justice on our last call of this advocacy group. So that is something, again, we can connect you to folks there that are looking to engage in that work. So just checking if there are any other questions. Okay. If there are any other questions for topics that we've covered, feel free, you know, again, to raise your hand or to put them in the chat. Otherwise, we are going to move over now to Lorianne McCulley of our staff to talk about some recent pricing information from USDA.
Yeah, sure. Thanks, Anne Marie. Anne Marie had asked me to come on and just quickly share some links to some USDA price outlook forecasts, just to give you all one more kind of tool in your tool belt. Let me go ahead and just drop this right in the chat so that you all can just have these two links. Just really quickly, just to explain, the first link is the USDA Consumer Price Index of Food, which Sabrina referenced. But this I feel is interesting this year because we see that, you know, food prices have increased overall 3% this year. They're expected to rise between 2 to 3% next year. And this isn't much more than average, but as Sabrina was pointing out, with real wages decreasing, it can feel really significant. And that also this year, or next year rather, there's quite a large margin of uncertainty, which can stretch up to 7 to 8%. And just to give you a little hint as to what the uncertainty is about, we're seeing, you know, not just the usual uncertainty, but also uncertainty with tariffs and other changes on the imports and exports. You know, and from a agricultural point of view, weather patterns being volatile and longer stretches of drought can drive food prices up. Next year, if we see mass deportations really having an impact on the farm labor force, that's another you know, factor that can drive prices up. And I don't know if y'all heard about the export market for soy drying up. This accounts, you know, farmers that grow soy account for 3/4 of all grain producing farms in the United States. And right now with the government shutdown, the timing of it is not fortuitous for farms who are seeking, you know, their payouts to basically remain economically viable. So that's another factor adding uncertainty. So just wanted to share one more tool in your tool belt to look at some of the potential uncertainty for food prices next year. The second link is just, you know, I really like data visualizations. It's really nice for comparison's sake to look at some historical data. And that just talks about some really cool, you know, data visualizations. You can look at volatility of food prices compared to other sectors and historical changes in proportion of income spent on food for different income levels and things like that. So it's a nice little reference to having your tool belt. So thank you.
Thanks so much, Lorianne. And just a note, we have revised our advocacy newsletter. Our first new version of that went out recently, and we are going to keep populating that with data and information like this that we know many of you find useful to share, one, just to stay current on what trends are in this space, but also in grant applications and proposals. So please be on the lookout, for those kinds of items there. And I believe, Amanda, if you could share in the chat, if you are not already registered to receive our advocacy newsletter and you would like to be put on that distribution list, Amanda will let you know in the chat how you can go about making that happen. And please share any feedback you have, on the usefulness of those resources. Happy to hear it and to, find kind of, meet your needs moving forward in this area. We do have some time now. I really wanted to make some space for folks to, have some time to talk with each other, with your peers as food assistance providers, about what anyone is seeing on the ground these days in terms of, changes that you may see in your distributions, in terms of the number of clients seeking. Are you starting to see the effect? Are you starting to note more federal employees, attending and seeking services? Just really, again, kind of whatever folks are comfortable sharing and want to hear from each other. Just happy to make some space for that here. And I'm sorry, Allison, there is a question in the chat about the disability exemption.
Yeah, so there is a form that can be filled out to get a disability exemption, and I'll make sure to supply that form. So far, we've just heard that that's the only thing that's needed is a form to be filled out. I think part of the form could be filled out by a doctor, I don't know if they're going to be looking more closely at those now that they're expanding the group or not, but so far that's all we know is that there's a form that you fill out along with the SNAP application if you have a disability, and then you can get the work requirement exemption.
Thanks, Allison. Definitely see some providers on the call. Again, feel free to either share in the chat or raise a hand, come off mute. Again, just happy to make some space, and fill folks in as to, what trends are we starting to see now in the county. Okay, thanks, Stephen. Right, so Living Faith, seeing gradually increasing numbers over the past 6 months, and seeing more federal employees. And thanks, Gabby had shared earlier resources in the chat for specific distributions that have been set up by CAFB in Montgomery County in response to the federal furloughs. So thanks for.
Right. And I just wanted to share, I was actually able to be at one of those locations in Rockville this morning. We served about 300 households, all of them federal workers, many different agencies, specifically NIH, FDA, DOJ. So many thankful folks there, just very appreciative, and so just sharing.
Thank you, Gabby. That's really helpful.
Mm.
And Dana from Mom also seeing more furloughed and laid off federal employees. Ruth, I'm afraid I don't know the answer to that. So are you saying that residents that are already in military service, or?
Yeah, I got a call this morning, my first one, who said he was in the service and he found our name on the food calendar and needed assistance. And so I didn't know if people who are active Army, Navy personnel, is there something special for them? In other words, could I refer him somewhere else also? Saying, go down to such and such. And anybody know about, personnel from the armed services?
Yeah, I mean, I will share that unfortunately it is the case that many citizens participating in the military do receive SNAP benefits. So I'm not aware of a separate military program. I haven't heard anything about military supermarkets, PXs and that. I don't know if they're open or closed during the government shutdowns. I'm assuming they're probably open just because I believe the military is still getting funded, so I can't be sure of that. But Ruth, I'm not sure that there are special programs that you could really refer them to. Yeah. Sorry, just checking the chat for. Oh, okay. Educare is taking military personnel. Rockville Help has been seeing increased numbers. Yeah, our own food resources specialists have been getting calls from federal workers for the first time after that check. And so what else is families? So 400 families and expecting more to come next week. They were running out of supplies to serve them. Yeah. Solomon.
Hi, sorry. I just wanted
Hi.
to come off mute, say thank you
Thanks.
again to everyone for, presenting the information. This is great stuff to learn and just be aware of as we approach all of these impacts coming. But I just wanted to share, I work at the universities at Shady Grove here in Rockville, Maryland, and we have a food pantry that we provide for students specifically. We have food and toiletry items, and we've seen a very, very substantial increase comparative to last fall to this fall. Like on an average day, we would give out maybe like 20 or so snack bags. And then this Monday, we handed out 45 in one day. And so, alongside with the students, utilizing these resources, we have our 2 monthly food distributions on campus, both with Mana Food Bank and Capital Area Food Bank. We have one with Capital Area this Monday, actually. And with that one, we don't really have a capacity of the amount of people we can take. So we've been seeing a gradual increase. I think last month we had 270 households, which might have been our most that we've taken. And so with our distribution next week, we got the updated data intake to include asking the patrons if they've been impacted by, the federal shutdown, if they were federal workers. So I'm interested to see, how those numbers, coincide with the increase. But with the coming months, especially with Thanksgiving and Christmas, we've moved our distributions up a week just to make sure that if people, won't be around during that time, or just so they have food during those times, those markets are operating. So I think I'll have to double check. I'm pretty sure we have them on the Montgomery County Food Resource Calendar, but I know sometimes the timing can be a bit adjusted. So, yeah, just wanted to share, even in our area, we're seeing these impacts and we're seeing the increase in need for food for both students and the community. And we're trying to see, like, we do have some students who attend our food distributions, but they're more geared towards what we specialize for them. But we want to try to avoid that kind of stigma of, utilizing those food distributions by just opening it up to the whole community as well.
Thank you, Solomon, for sharing that, and thank you for the reminder about sharing your distribution information in the OFSR calendar. Appreciate all of you who are doing that already. And I do want to add, because I think some of you had reached out about a problem with the time frame for which you were able to upload the number of distributions. It used to be 3 months, and that something had happened where you weren't able to enter for that long anymore. I know OFSR did speak to IT, and you should now be able to enter dates up to 100 days in the future. So that has been restored, but please do keep us posted if you see any other changes. Sometimes something happens at the IT level and it may not get fully communicated out, or there could just be a glitch, that we're not aware of. So thank you for raising those issues, and we're always happy to assist with figuring out what's going on. Risa is from Food and Friends is wondering if anyone is distributing Thanksgiving dinners. I'm assuming, Risa, are you talking about a prepared meal or just components thereof?
Yeah, so we distribute, medically tailored meals. And so if someone isn't eligible for our Thanksgiving dinner distributions, we'd love to connect them with an organization that they might be eligible for. So I just want to get like a list of everyone out there.
I know many of our providers have participated in the past in the county's holiday giving program for Thanksgiving and for Christmas and holidays. I know again that again the requests for those has greatly exceeded the availability of resources over the past couple of years. So I'm not sure, but yeah, if there are providers there who have capacity, again, feel free to let me know, and I'm happy to share that information out as other organizations are looking for resources. And Victoria, a question for Capital Area Food Bank. How does the food recovery program trickle down to organizations for distributions, or is the recovered food only sent to local food banks?
Yes, and I'm with Bethesda Help. I'm a volunteer for their newsletter I write. And so this is my first call.
Oh, hi, welcome.
Thank you so much. And so when I heard that, I was wondering, like, how does the recovered food play into the larger ecosystem? And especially now where it seems like an on-demand sort of system is more necessary than ever. How does that like tie together, or how can we increase awareness about that?
I don't think anyone from our food resources team is on the call, but maybe Augusta or Roberta, if you have any more knowledge than I do about Partner Direct, you could share about how we connect our partners with those retail stores.
Yeah, sure. Thank you, Sabrina. Yeah, so, and, the Partner Direct, which is the program that the food bank runs, and that's basically, what you call the food recovery. So what we do, we establish a relationship. So the relationship established from Feeding America level to food banks, and we manage those relationships with the local grocery stores for the service area that we cover. Then what we do, we establish a relationship between those grocery store to one of our partner networks. So from there, our partners go and pick up food, and that will vary, depends on the type of the store, the size of the store. Sometimes they can go once, twice, or 3 times a week to recover food. So that's the relation. We manage the relation like at a high level, but then our partners manage a personal relationship with each of the store where they recover this food, and they can incorporate that food and it's provided directly to the client. So that doesn't go to a food bank, it doesn't go to any place, but it goes directly to the clients. And that's something we manage, and we have specific stores that we have in the list. We have specific partners. Obviously, there is a lot that has to do with capacity, the number of the stores that we have, how we assign it. But they do go directly to the client at the end with all that food that's being recovered.
And when you say directly to the client, for example, is that like, quote, if Bethesda Help was the partner, they would get this food recovered from a grocery store, and then Bethesda Help would get that to a client? Or are these people going directly to like a Giant to get food? That's the part that I'm missing.
Oh, okay. No. So So in this case, any partner that go to that store, they bring the food to their warehouse or the pantry location. So when they have the distribution, they incorporate that food that they recover to any other source of food that they have and provide directly to the client for that food. So now the client never goes to a store and say, oh, I want for recovery now. So that's being collected in one place and that being distributed through our regular distribution sites through our service area.
And are the partners on your website?
Sorry?
The partners for the
No, we don't have a list of our partners on website, but we have a list of all, not like I said specifically, but if you go on Get Help map, you will find all the partners that are part of our network where clients can access food through them. So, and literally, yes, so you will find them there through Get Help information.
Okay, thank you.
And I think, Grace, I have added that so you can have access to that in the link.
Great, thanks. Okay, and thank you. Sharp Street United Methodist Church and Only will be providing turkeys as part of their November distribution. No requirements, but first come, first serve, and 1 bag per car. So. Oh, and thanks, Pam, for Farm Services. Hey. We will be sure to note any of these resources listed in the chat and share them up in our follow-up resource email like we have come to do, so you will get those there. I did want to share that we will be having a November food security community call that will happen back on our usual schedule of the second Monday of the month. So that will be November 10th from 1 to 2:30. And we are going to be discussing navigating various state and county health department licensing for food pantries. So please be sure to join us then. And feel free to reach out to me in advance if you have specific questions that you would like to know. But our plan is to have some of your peers who have navigated these systems successfully and for a while come and share about their experience. Yes, Denise, it's in the chat and we will share it out, but it is the food pantry at Sharp Street United Methodist Church in Olney, November 15th. All right. If there are no other questions or folks that want to share, if you have just an update from your organization that you'd like to share and make folks aware of, happy to, give you time to do that here. If not, happy to give you a few minutes back in your afternoon, and we will see you in November. Thanks everyone for joining. And again, thanks so much to Sabrina and friends from Capital Area Food Bank for joining us today and all of this great information. I know that many of you will be looking to that data to inform your programs and grant applications in the future. So again, Sabrina, thank you so much for taking the time and the effort for Montgomery County specific information. Thanks. Have a good afternoon, everybody.